thrilled to be joined now by three gentlemen that you all know and who represent these two great societies here at this meeting and really international. We're going to talk a little bit about that. Jeff is the president of the Heart Valve Society of America. José-Luis Pomar, who's the president of the Society for Heart Valve Disease, and Gino Gerosa, who's going to be the president-elect. Is that right?
Correct.
These two societies? I got it. Okay. So tell me a little bit. It's a fabulous meeting. You've got 700 people from all over the world. The concept of two societies really collaborating on education, which is designed to help our patients, but really to educate each other. Tell me a little bit about that. Who wants to start? You can say something.
Well, I think the format is really unique. Many societies, they concentrate on only surgeons or only cardiologists, only basic scientists. Here we have everybody together, and we are all concerned about patients with valve disease. And I think this is why this is a very successful type of meeting. And we are looking forward to get together and do more things in this same way.
No, it's very, very impressive. Jeff, from your standpoint, the relationship not only with these gentlemen individually, but the societies, what are your thoughts?
Yeah, it's very satisfying, and I would say more than satisfying, it's very important. The missions of the two organizations, which originated independently and really largely ignorant of one another, and naturally gravitated towards one another, extend beyond education. We want to support research, we want to support information provision to the general public as well as to each other. And that's critically important. Heart valve disease is becoming more and more important as an entity in the world as the population ages, because, as you know, heart valve disease is the disease of aging. The issue then is to get the people who are most interested in this area of cardiology together so that we can fashion strategies and information that will help all of us to take care of patients with heart valve disease better than we do now. The community of doctors who are particularly interested in valve disease is not all that large. So to have an organization in the United States, an organization in Europe, an organization in South America, an organization in Asia, doesn't make any sense. We all ought to be getting together and teaching and helping each other, and that's what this synthesis is about. We've had this idea for several years. We got together with the Society for Heart Valve Disease in a sort of a semi-formal way beginning in 1907, and over the 5 years we've come to the point where we are now, where we're ready to formally engage and unite. And it's not just the United States and Europe. It's the United States, Europe, and every place else in the world. My expectation is that the board of this new society that we're forming will have representatives from South America, from Asia, from Africa, wherever, because we really need all points of view, all regional differences in the manifestations of valve disease being represented, and that's what we want to do.
No, it's really good. Gino, tell us your perspective.
Absolutely. Global networking is becoming crucial nowadays in the world, in every field, and this is even more true in the medical field. And of course, this is a global networking at two different levels. It's a networking of basic scientists, interventional cardiologists, clinical cardiologists, anesthesiologists, and cardiac surgeons. And then at a higher level is in a global networking of different countries, of different nations. And this is, of course, for the help of our patients.
And, I mean, I think you all make great points. I mean, I think the concept of that we learn from each other internationally, and this is a very unique forum in a time when this whole field is really developing, and we're not only educating ourselves but educating the consumer. I mean, I think that's a very valid point. How you do that is really going to be the interesting thing. Now, I know that you had a very successful meeting in Barcelona.
We had also a nice meeting in Barcelona.
Yeah, recently, yeah. I mean, a year ago.
And I think it is also because for many years the cardiologists in general, the cardiologists and all the cardiology world was very concentrated on ischemic cardiomyopathies and what is called coronary bypass or coronary disease, in fact. And valves were a little bit like, well, everybody knows there is some people having valves. Rheumatic heart disease was mainly in undeveloped countries. Sure. So the idea well, let's concentrate in coronary artery disease and not on the others. And today we have the age of the people. They are becoming older and older, so we have more aortic valve disease and a fantastic image. Before 20 years ago, we didn't have any echo or anything. So we can recognize this pathology earlier and we can treat it much better than before. And we today recognize that also in undeveloped countries, the rheumatic heart disease is a real epidemic problem. Is a huge amount of people really needs to have a treatment for this. So I think it's pushing everybody to this kind of meetings.
You know, sitting and listening to the opening plenary session this morning that you all were involved in, I mean, you really got an overview of sort of the advances and where the field is. But I think the thing that strikes me is just the interchange of information that's going on throughout this meeting arena. As I said, with 600-700 people. And so it's bringing all of our level of knowledge up. And I think it will advance the field. So a joint society.
I would take advantage of the heart team example.
Right.
In the best institution, either academic or not, everybody's working as an heart team in order to provide to our patient the best solution, tailor it to his conditions. Now we should just upscale this heart team to a higher level. But that's the point.
No, absolutely. And I think the whole concept of how do you get, because the field is moving rapidly. I mean, you've been in the valve arena forever, it seems like. But you think about how do you get the educational information out in almost, I don't mean a consensus document, but in a consensus. And so bringing together the world's experts at various levels is a great opportunity.
Yeah, it's true. It is very important to disseminate what information we have, and it's not clear how you can best do that. What is clear is that there's no one way. So a meeting seems like a good thing, not just because there are people who lecture and people who speak and give opinions, but because of what goes on in the back rows of the meeting.
Absolutely.
It's the interactions, the informal interactions between the members, between the participants in the meeting that I think may have the greatest impact. And of course we need more than that. We need more than meetings. Only 700 people come to a meeting, but there are 10 times that many who really would benefit from, doctors who would benefit from having the information we're disseminating here. So we're publishing some of the proceedings of this meeting. We put out video discs. There are lots of ways to distribute information now with the internet, et cetera, print publications, and I think we have to use all of them. With a large, vibrant society, we can think through the best strategies and we can have the resources available to be able to affect this kind of information distribution.
Also, strong society can be, the starting point for important worldwide trials, for clinical trials.
Absolutely.
And I think that one of the major mission of the new society, the joining of the two societies, should be this one.
That's an excellent thing. So,
and there is maybe something else. I think before every specialty was thinking about his own work. Today we try to focus on the patient. But I think tomorrow is not going to be the patient, it's going to be the person. Because we want to have the people before getting ill and trying to avoid having a problem. If we can know more on the basic research, how the mitral prolapse develops or the aortic stenosis, probably we'll be able to treat them before
intervene.
They intervene before.
That's an excellent point. Well, I congratulate all of you on not only the success of this meeting, but everything you've done for both of these societies and the concept of a universal society, okay, that will not only educate all of us, but especially the cardiologists, the cardiac surgeon, and interventional cardiologists, anesthesiologists in the future, because this society will represent the field. Isn't that correct?
Yes, we expect that that'll be true.
Good. Well, I appreciate what you all have done, and thanks very much for listening.
Thank you.
Good.